Hello and welcome to our special show, Save a Life. I am Priyanshi Sharma. Life is valuable and precious. Being able to revive a person's heart to save their life will provide one with immense satisfaction. It's a sad but a true fact that the number of people dying from cardiovascular diseases is steadily rising in India. Most of these cardiac deaths are sudden and on the spot. It is possible to prevent these sudden cardiac deaths if they receive immediate medical attention and CPR. The recent incidences of some celebrities collapsing suddenly and passing away due to a heart attack are concerning and shocking. There is an alarming rise in the number of young patients with heart attacks and sudden cardiac arrests. What is equally scary is that sudden cardiac death may happen in people who have no known history of heart diseases. The risk is higher for patients with existing heart diseases. In almost every family, we have at least one family member with a heart disease. Now, a question is, can one make himself or herself capable enough to save a life in emergency situations? The answer is yes. It is possible if you're well trained in CPR. Many adults in cardiac arrest can be revived with intact neurologic function if the bystanders provide immediate CPR. Raising public awareness and understanding of the practical applications of CPR is an essential strategy to increase the success rate of CPR in cardiac arrest cases. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest, train them on CPR and highlight the role of CPR in saving a life. Now, to throw more light on this, we have guests joining us on this discussion. Dr. Himanshu Rana, who is a consultant interventional cardiologist and the head of Department of Cardiology at the City Hospital in Haridwar. We also have Dr. N.S. Rama Raju, who is the chief interventional cardiologist at KIMS hospitals in Rajamundry. We also have Dr. Shubham Agarwal, who is a consultant cardiologist at KVR Hospital in Kashipur. Thanks very much, doctors, for joining us on this discussion. And Dr. Rana, if I can first begin with you. Cardiovascular diseases have now become the leading cause of mortality in India. Why are Indians more prone to cardiovascular diseases?
Actually, first of all, good afternoon to all the viewers. Actually, what we see in the Indians, there has been a very steep increase in the past decades for the traditional risk factors, what we call as diabetes, metabolic syndrome, hypertension, smoking. But these risk factors are prevalent also in the other countries. But why there is a drastic increase in the incidence of cardiovascular disease, that we need to know right now. First of all, we need to look at the risk factors that have recently come up, like the consumption of junk foods. Second is the lifestyle, which has been seen a drastic increase in sedentary lifestyle. Because of sedentary lifestyle, people are sticking to their screens. They are having sitting jobs. Previously, Indians used to have high mobility. They used to practice agriculture and all. That has resulted in reduced heart diseases in the previous decades. But recently, because of all these newer risk factors that have come up, has resulted in increased incidence of cardiovascular diseases and increase in the mortality also. Second thing is these cardiovascular diseases are occurring more in the younger patients, especially Indians. Why? Because these newer risk factors are more prevalent in the younger generation as compared to the older generation.
Right. And
also, third thing is Indians have a greater predisposition to heart diseases. If we see on a genetic level also. So these risk factors we need to look into, and we need to control these risk factors. And if anyone develops these heart diseases, then they need to consult these the specialists of these diseases.
Right. Right. And my next question to you, Dr. Raju, what is heart failure? And is it a sign that your heart has stopped, or is it about to stop beating?
Heart failure, as such, the term is a quite confusing term, especially for the general population. Many of the patients and patient attendants ask us whether heart failure is really stopping of the heart. But heart failure is not stopping of the. It's a cardiac arrest, that is where the heart comes to a standstill and patient immediately dies. But here, heart failure is the efficiency of the heart has been come down by various reasons. Maybe the patient may be having associated valvular heart disease, ischemic heart disease, or muscle damage, or whatever it is. The heart efficiency will come down, and heart will not be able to state to meet the requirements of the body. So whenever the patient exercises or do something, heart will not be able to in a condition to meet the requirements of the body. So immediately the patient will develop breathlessness, and over the long term the patient will develop edema of the feet, and there will be collection of the fluid in the lungs. The patient will be not able to sleep. They will be better come in the sitting posture, and they will not be able to do the routine work, etc. So heart failure is not a cardiac arrest as such. Heart failure is inefficiency of the heart, and it cannot meet the requirements of the body. And whenever we are treating the heart failure, we need to address what is the causative factor of the heart failure. And the majority of the times in India, it is the coronary artery disease that is the leading factor for heart failure, and which needs to be treated at a very early stage to prevent the development of heart failure and LV dysfunction.
Right, and Dr. Agarwal, as we've just discussed, that heart failure is a serious condition. Now, what causes a heart failure, and can its failure be reversed?
If you talk about causes of heart failure, one of the major causes in our scenario is coronary artery disease. Coronary artery disease is narrowing of the arteries. That blood supply is not there to supply the heart, so heart pumping will decrease and will ultimately lead to heart failure. Other major causes are like myocarditis. Some toxin injection is there, and it has a genetic correlation also. Rheumatic heart disease, particularly in you can say developing countries like India, is there. Hypertension, one of the major cause of congestive heart failure, is also there. So we can say coronary artery disease and hypertension are the two major causes. Other some causes are also there.
Right, and now that we have talked about the causes, if we talk about the symptoms now, Dr. Rana, what are the signs and symptoms of a heart failure, and can we detect heart failure in the early stages? Dr. Himanshu Rana, that question to you.
Yeah. Coming on to the heart failure, actually we have varied symptoms, and according to multiple etiologies or what are the causes of heart failure, we have different types of symptoms. But if we want to know as a general, then we can have like if a person develops breathlessness on exertion, or they frequently develop ankle edema or pedal edema, or they have breathlessness on lying down, then these can be really symptoms of heart failure. Then another important thing is that what we had a previous misconception that only heart failure can be a result of a valve disease in the heart, or because of reduced pumping of the heart. But that has now been completely outdated, and now we have a heart failure entity that can occur with normal pumping also. So if any of these symptoms, like somebody develops shortness of breath on exertion, fatigue, irregular heart rate, or if they develop ankle edema, then it is likely that they may be suffering from heart failure, and they need to consult the doctor immediately.
And now if we can come to the possible treatment options, Dr. Raju, what are some of the common heart failure treatment options? Can it be treated with medication?
Heart failure can be treated with medication. 90% of the heart failure treatment can be treated with medication, provided if they are treated in the early stages. So if we can treat what is the causative factor of the heart failure, like correcting the ischemia and treating the valvular heart disease, or associated diabetes or hypertension, if we can treat early, we can even reverse the heart failure. But if the heart failure is detected late, and patient may have to go for even other therapeutic modalities, like they may have to go for an ICD intracardiac defibrillator or CRT, like the biventricular pacemaker, and in the extreme stages they may have to go for a heart transplantation also. So the early detection of the heart failure is very, very important for effective management in the early stages with the medications which do a really good job, and they can treat nearly 90% of the patients without progressing to a severe stage of the heart failure, provided if we start early, we treat the causative factor for the heart failure. And there are a lot of medications nowadays for the, especially the heart failure, and especially the four important classes of medications like beta blockers, ACE inhibitors, ARBs, AR9, and recently SGLT2 inhibitors. Some 4 or 5 classes of medications, really they are doing a very good job, and in some of the patients we can even reverse the heart failure. But by and large, heart failure has to be detected very early in the early stages, and once we start the management early, definitely we can do a lot of help with the medical management alone.
And as we've discussed, heart failure can lead to many serious complications. So, Dr. Agarwal, does heart failure cause sudden cardiac deaths as well?
See, if we talk about cardiovascular disease, heart failure itself is a major, you can say, one of the most complicated heart disease. It can lead to maybe a serious complication. See, heart failure patients generally have 6 to more times more propensity to have ventricular arrhythmias. Ventricular arrhythmias is like there's sudden increase in the heart rate and may lead to sudden cardiac death also. Other common complications with heart failure is like patient may develop accumulation of fluid in lungs. That will cause severe breathlessness, and patient again may end up in cardiac death also. The you can say major complication includes dysfunction in the renal function, like kidney function may be deranged, and patient will end up in renal failure, and can ultimately cause multiple organ dysfunction and can cause ultimately sudden cardiac death also. The major thing we can say, like if patient is in heart failure and it is in florid state, then life is generally compromised, and patient will be on multiple drug therapy, and nowadays various device therapies are also there. But still, as my colleague has already said, that if heart failure is managed earlier, then these complications will not be there. Once it is complicated, it's difficult to treat.
Right, those are of course important warnings for all of us to note. With that, we'll pause for a very short break now, but we'll return with more important questions. Stay tuned for that and a whole lot more. Welcome back to our special discussion where we're discussing heart diseases, means of revival and treatment, etc. Now my question to you, Dr. Rana, in which conditions is CPR given? What is CPR really?
Yeah, actually CPR is what we call in medical terms as a cardiopulmonary resuscitation, and it is an emergency procedure when we have to revive the somebody's heart. It is actually given when some person's heart stops beating. So cardiopulmonary resuscitation is given in patients with cardiac arrest, but actually what we lack in today's scenario is proper training when to give a CPR and how to give a CPR. CPR is like giving chest compressions along with temporary breathing, so that heart may be able to pump enough blood to the body, and so that there should not be any permanent damage to the brain and the vital organs of the body until medical attention is sought. So the priority that we need to give during a CPR is the chest compressions. So, but the first and foremost thing is ideally that we should identify when to give a CPR, because effective CPR can definitely save a life.
Right, and while we are talking about the importance of CPR, Dr. Raju, lack of CPR awareness is a big health challenge in India. If you could please tell our viewers about what are the main steps of CPR?
In India especially, lack of awareness for CPR is the major killer, because majority of the sudden cardiac deaths, especially out of hospital cardiac deaths, nearly 40 to 50% of the deaths can be prevented or can be handled by a layman if they are trained to handle cardiac arrest patients. But unfortunately, because of the lack of promotion or the different versions given by media, or like in the sense of movies, or what they do is what the practice general people practice. See, whenever we see an unconscious patient suddenly landing in a, say, whether it's in a house or a public areas, movie theater, or in the road or something like that, majority will be seeing the patients giving other modalities of leaving the other aspects. And first and foremost important is giving chest compressions. That is very, very important. But every time people will be speaking about mouth to mouth breathing, because it is very difficult to keep a mouth to mouth breathing in a stranger because of the different communicable disease like HIV or whatever it is. We will be scared to give a mouth to mouth breathing to a stranger. But most, because of that, they will not be coming forward to do a CPR. But most important, especially in a outside of hospital cardiac arrest, is whenever a patient was found to be suddenly unconscious on the road or in the hospital, the first and foremost responsibility of the person who is nearby is to check the pulsations. Pulsations, especially the carotid pulsations, are the easily palpable pulsations. If you keep a hand like this on the neck, we can feel the pulsations. Suppose the pulsations are not felt, immediately one has to give a cardiac compressions. They have to clench the both hands, keep it on the lower part of the chest, and they have to give a repeated chest compressions, and they have to be given at the rate of 100 to 120 per minute, and the chest should be compressed at least 1 to 2 inches and every time. And this process of giving a chest compression should not be stopped until the patient regains his consciousness. So every time we have to give at least 3 to 4 minutes chest compressions, stop a while. If any help person is there, they have to feel the carotid pulsation. If the pulse reappears, then definitely we have saved the life. And there are many incidences where giving a CPR on the roadside or in the public places, we can save a life. And especially the Cardiological Society of India and the STEMI organizations are now taking a lot of programs in training, especially students, police people, fire persons, and all other groups in training for CPR, because many countries have witnessed that training public in the CPR programs, the incidence of sudden cardiac death have significantly reduced, and many of the heart attacks can be treated. Nearly 40 to 50% of the heart attacks which are dying on the road and before coming to the hospital can be resuscitated by doing a CPR by lay persons. So increasing awareness among the lay persons, and we need to do more programs to train the non-medical people in all the groups, students, etc., to do a CPR. Because once you do a CPR, we can save many lives. They can be safely brought to the hospital. Nearly 40 to 50% of the sudden cardiac deaths can be prevented by doing an effective CPR.
Right. Of course, those steps are very important for all of us to remember to save a life. And Dr. Agarwal, what if the person recently underwent an open heart surgery and has had a cardiac arrest? Can we perform CPR on such patients?
First of all, just mark my words, any patient who is found unconscious and is pulseless, CPR should be started immediately. If it is not done and we have not intervened by CPR, then patient will succumb to death. And if we talk about surgery, if surgery is not recent and wound is healed, then CPR can be performed without any major harm to the wound. But if stitches or wound is not healed and patient has gone into cardiac arrest, then still CPR has to be performed to save the life. But you can say in cardiac surgery, there are breast wires there that may break, but still cardiac CPR has to be performed meticulously.
Right. And my next question to you, Dr. Rana, is it possible to lead a normal life after a cardiac arrest?
Yes, actually, if a CPR is given immediately within a crucial time frame, so people usually do a lead a normal life, but they have some degree of impairment of brain functions. But if the CPR is given within a time frame and it is proper CPR, then definitely they can live a normal life. But again, when a cardiac arrest occurs in a person, then usually the mortality is very high because either the CPR is improper or it occurs out of hospital cardiac arrest. So the proper CPR could not be given, or a timely medical intervention could not be sought. So otherwise, if all these conditions suffice, then a person can definitely lead a normal life.
That's definitely good to know. And my next question to you, Dr. Raju, is it true that unless you have high blood pressure, the intake of salt is not bad for you?
So nothing like that. High salt intake is always deleterious, because once you take a high amount of salt, the chances of developing hypertension will be more. And especially this sodium consumption is very high, especially in the South Indian states. Of course, being a tropical country, we lose a lot of sweat, and some sodium loss will be there through sweat. But by and large, eating a high amount of salt is always deleterious. And what is the recommended consumption for any common man? It should be less than 5 grams of sodium chloride. But especially in the heart failure patients and patients who are having a cardiac disease, the sodium consumption should be much less, and it has to be restricted to 2 to 3 grams per day. And always excess sodium is always linked to adverse problems like arteriosclerosis, hypertension, etc.
Right. So important to note all those risks associated with a high salt intake. And with that, my next question to you, Dr. Agarwal, how can yoga help reduce stress? What are the other benefits that yoga has for heart health besides the stress relief factor?
See, if we talk about yoga causes relaxation of body, mind, and muscles. It increases strength and flexibility of the muscles. So generally, it increases the capacity of an individual to do exercise. And most importantly, it causes decrease in BP, heart rate, cholesterol, sugar. This BP, you can say hypertension, cholesterol is dyslipidemia, and diabetes. These three are the major risk factors that cause cardiovascular disease. So directly or indirectly, yoga causes decreases in you can say controlling diabetes and hypertension. So in any way, it will help to reduce cardiovascular disease and will increase the exercise capacity. So you can say yoga definitely causes reduction in cardiovascular disease and should always be adopted in our daily routine and in our lifestyle.
So yoga has several benefits, as you pointed out. With that, it's a wrap on this show. Thanks very much to all the doctors for joining us and answering those very important questions. We hope this discussion helped our viewers learn more about heart diseases. Thanks very much for watching. Goodbye.